Hello everyone. It's a very good morning to all. Wishing you all a very happy Sunday. We'll start off with today's classes. The first class on cell and general physiology. My name is Dr. Abirami, your physiology faculty at DBMCI MDS experts. And usually I start all my classes with this small story. Not a story, something which happened really. The story of this man called John Carpenter. John Carpenter, he was the first person to win $1 million in this program called Millionaire. Hope you have watched this program. Yes, how many of you have seen this program called Millionaire? Yeah, it was telecasted in all languages. In Hindi as Kaun Banega Crorepati by Amitabh Bachchan. And this is the actual original English program. Yes. So in this program, you have a series of questions. Every question you answer, you will have a chance to win money. The last question you answer, you can win $1 million. And John Carpenter was the first man to win $1 million. And there are some helplines in the program. Like, they'll give you 50-50. Of the 4 options, you can remove 2 options. So either A, B, C, D. C, D will be removed. You can choose from A or B. That's called 50-50. And the other helpline is you can call somebody and you can ask for the answer. That's called phone a friend. You can call anybody and you can ask for the answer. This man, John Carpenter, he did not use any of these helplines till his last question. And on his last question, he said, I want to call somebody. So the person is asking, whom do you want to call? So he said, I want to call my father. It's a live program. Whole world is watching. He's calling his father and he's talking to his father. So he's telling his father, I did not call you dad to ask the answer for any question. Just to tell you that I'm going to win $1 million in the next question. He just said this. He kept the phone. He gave the right answer and he won this $1 million. So when asked, why did you do like this? He said, my father is a very poor, illiterate person. He does not even know how to watch this program. So I wanted him to be the first person to know that I'm going to win $1 million. If the program is telecasted, the whole world will come to know. Only then my father will know. But I wanted him to be the first man to know that I'm going to win this. That's how even before giving the right answer, he told very confidently that I'm going to win $1 million. This much of self-confidence. How will you get this much of self-confidence? Even without knowing whether it is the right answer or not, he's saying that I'm going to win. Clarity in the subject, because he knows that this is the right answer. Nobody can change the right answer. 100% he is sure about the subject. He knows that this is the right answer, and the clarity in the subject has given it this much of self-confidence. So whenever you go for any competitive exams, NEET exam or an INSET exam, usually students keep searching for self-confidence. Where will you search for self-confidence? Maybe in an Instagram reel where somebody is climbing a mountain and there's a nice BGM music from behind and somebody will say you can do it. You will not get self-confidence from any of these sources. Even if I talk to you the whole day regarding motivation, confidence, I try to motivate you the entire day, that will not give you self-confidence. How will you gain your self-confidence? Don't waste time on all this. You sit and learn your subjects. You know the subject thoroughly. You know the right answer. That will give you the self-confidence. Clarity in the subject only can give you self-confidence. Any number of WhatsApp messages or motivating messages, motivating speech, videos, nothing can give you self-confidence. So students, whenever you go for the exam, you just have enough clarity in your subject. Just imagine in your exams, if you know the right answer for the first 10 questions, imagine the amount of confidence that you will carry throughout the paper. And the other way also is true. If you don't know the answer for first 10 questions, you will lose your confidence throughout the paper. So knowing the subject, reading the subject, clarity in your question and answers, that alone can give you self-confidence. That was about John Carpenter. Everyone has a dream, but not everyone has a plan. All these sperms, they are running to the ovum. But look at that little one with a bouquet in its hand. So all the sperms are doing hard work, but this one in the center, this alone is doing smart work. To approach any entrance competitive exams, NEET exam or INSET, any competitive exam, hard work is not important. Smart planned work only is very important. because you hardly have 6 to 7 months of complete preparation. During this period, you cannot sit and read all the subjects entirely. To read all the subjects, it is not possible. So you should know what to read and what not to read, where you should give more importance. That is called the smart planned work that you can do. So don't try to read anything and everything that comes on your way. Give more importance for high yield topics. That is the best smart planned way that you can work on, giving more importance for high yield topics. What are the high yield topics? Whenever you go for any exam, let's say your first year dental exam, how did you prepare for your exam? You have hardly 1 month for your exam. You want to clear your subjects. What will you do? You take last 8 years of question papers and you read all the questions and go. Definitely you will pass your exam. Previous year questions. Any exam, the most important mantra is previous year question papers. Don't go to the exam without solving previous year questions. PYQs are very, very important. Previous year questions are important and previous year topics are also very important. So any student who makes a mistake in a previously asked question, you will not be there on the list at all, because even an average preparing student will have a strong hold of PYQs. So you should have a thorough knowledge of PYQs. You should know the answer for all the PYQs and you should be well versed in all the previous year topics. That is the most important planned smart work that you can work on. The other thing is Hebb's rule. What is Hebb's rule? In neurophysiology, when we learn about synapses, what is a synapse? Junction between two neurons. So there are two neurons. The junction between two neurons is called as a synapse. Everything is stored inside synapses. All your memories, information, your subjects, everything is stored inside synapses. And Hebb's rule is you can activate your synapse. You can strengthen your synapse or you can weaken your synapse. It is based on you only. How do you strengthen and weaken your synapse? That's called Hebb's rule. See, for example, let's say a guy in your class or you only, you are in love with a beautiful girl or you were in love with a beautiful girl. And every time you think of that girl, your brain is converting short-term memories of the girl into long-term memories. Hippocampus in the brain will do this, converting short-term memories into long-term memories. So when the class is boring, you're thinking of that girl. Or when it's raining outside, you're thinking of the girl. You listen to a nice romantic song, you're thinking of the girl. Every time you think of that girl, automatically your hippocampus is converting short-term memories of the girl into long-term memory. So that is why even after a breakup, even after a love failure, you are not able to forget the girl, because your brain has already converted the memories of the person into long-term memory. You will never be able to forget that person. So likewise, you do the same thing to your subjects also. If you are able to convert short-term memories of physiology into long-term memory, no need to remember physiology lifelong, but at least till your exams, another 6 or 7 months, you should be able to remember. So how do you do that? Like how you think of that girl again and again, you revise your subjects again and again. One time you read, but at least 3 times you should revise. Only if you revise the 3rd time, your hippocampus will be able to convert short-term memories into long-term memory. So revision is the most important part of any preparation, any competitive entrance exam preparation. It is not about reading everything. You read less, but you revise the same content again and again. Any question that is asked from the portion that you have revised, you will get it right. So revision is very, very important. So please remember, read 1 time, but revise at least 3 times. Practicing a daily routine. This is very, very important. Practicing a daily routine means like how you take breakfast, lunch and dinner every day. You should try to solve at least 25 questions per day. I'm telling you a minimum of 20 to 25 questions per day. Because when you solve questions every day, especially try this online mode of solving questions. You have subscription to so many apps. And DBMCI MDS app is giving you so many questions in the question bank. So try to solve these questions online mode of solving question. Because when you solve online questions every day in an app using mobile or your laptop, you're getting used to the online mode of exam. Your time restrictions in your exam can be easily managed by solving questions every day. How many of you can type hi dear without looking into the keyboard? Yes, I can type hi. Yes, all of you can do that. That's because, did you learn any typewriting? Did you go to any typewriting class? No. But how are you able to do that? Because every day you're typing hi, dear, good morning, every day you do this, automatically your fingers are getting used to that speed, and even without looking into the keyboard, you can type a message. So that comes by practice. The speed management, the time management in exam definitely improves by solving questions every day. The other thing in solving question every day is you should know how much time to spend for a question. For example, you see a question like this. Yes, can you type the answer for this question? Yes, any of you? Can you type the correct answer for this question? What is the correct answer? A, B, C or D? The question is 2024. Will you go with option A, B, C or D? Yes, somebody says option A, 2024. You're right. Why not option B? Option B also has 2 zeros and 2 4. Option C also has 2 zeros and 2 4. Option D also, there's a 2 0 and 2 4s are there. So when you see a question like this, all 4 options are looking like the right answer. Now which one will you go for? What is the best thing that you can do if you see a question like this? See, when you have negative markings in your exam, you cannot answer all the questions. You have to leave some questions. So which question which you leave? If you see a question like this, where you are not at all able to rule out any of the options, don't waste time on a question like this. Leave it and go to the next question where you can get the right answer. If you are not at all able to rule out any of the option, do not take risk in this question. How will you identify these type of questions? When you solve questions every day. Every day when you keep solving questions, you just imagine the number of questions you would have solved, and you would have become an expert, and you can even join in the question setting team, that you would have seen so many questions, so many different patterns, so many different options, that you will so very well get used to the pattern of your exam. And on the day of exam, you will very well know which question to answer, which question to leave, which question I should spend more time, where I should not waste my time. All this comes by practice only. But if there is another question where you are very sure that A is not the answer, B is not the answer, it is either C or D. You have already ruled out 2 options, and this is a question which you should never leave, because 50-50 you have chance of getting it right. Even 50% if it goes wrong, 50% is a chance of getting it right. So definitely spend some more time in this type of question and try to answer this question. Most of the time your instincts will be correct. And the other important thing in solving questions every day is checking your instincts. How will you check your instincts? Mostly students keep asking us, ma'am, what is the strategy to crack NEET MDS exam or INICET MDS exam? There is no single strategy that will fit into all students. That will never happen. You should know what your strategy is. How will you fix your strategies? If you solve question every day, on the day of exam, you will come to know what is your strategy. For example, let's say I told you to solve 25 questions every day. So you're trying to solve 25 questions every day. Out of these 25 questions, 20 questions you know the answer. But 5 questions you don't know the answer. So what will you do? You will guess the answer. So every day you are guessing the answer for 5 questions. And every day all the 5 guesses are correct. Every day you're guessing 5 questions. Every day all the 5 guesses are correct. So on the day of exam, what will be your instinct? If you have a question where you have to guess an answer, you will be very sure that most of the time your instincts are correct, and you will take more risk in solving more number of questions, and definitely it's going to give you the right answer only, because all through your preparation, every day when you were guessing the answers, they were right. Your instincts are always right. So you can take more risk and you can get more plus marks. You can get more of positive marks, and definitely you will be on top of the list. In the other way also is true. Let's say every day you are solving 25 questions. 20 questions you know the answer. 5 questions you don't know the answer. And every day you're guessing answer for 5 questions. And every day all the 5 questions which you guess are correct, are wrong. Every day your 5 guesses are going wrong. So on the day of exam, what will be your instinct? Every day I've been guessing 5 questions, and every day all my guesses are wrong. So if you have to take a risk in your exam, you will think twice. You will not go for taking more risks. Thereby you will be avoiding negative markings. Unnecessarily you will not get negative markings, because you know that most of the time your instincts are wrong, your guesses are wrong. You will just not go for more number of guesses, and all that will help you in avoiding negative marking, and finally again you will be on top of the list. So this is how you set your own strategies just by solving questions every day, a daily routine practice of solving MCQs. You spend 60% of the time for reading, the remaining 40% of the time you spend for solving MCQs. That will take you to a higher place. Yes, with that introduction to physiology and also preparation for your exams, let's move on to the first topic for today, cell physiology along with general physiology. Cell physiology, this is a very basic topic. Usually in biochemistry, we do this in detail. So just in physiology, two important topics related to the physiological part of cell physiology. Transport across the cell membrane composition along with transport across cell membrane, and also cell junctions. These two topics we will do. First of all, what is the composition of your cell membrane? Normally, 55% proteins, 40% lipids, and 5% carbohydrates. This is the cell membrane composition. So normally you see that proteins are little more than the lipids. But there is one exception where lipids are more. Lipids are 80% and proteins are only 20%. Very, very less concentration of protein and very, very high concentration of lipid. If lipids are more, they act as an insulator. So which is that insulating membrane on the axon? Myelin membrane. That was a question. Which is that only exception where lipids are more and proteins are less. This is the myelin membrane. And what is the role of myelin? Myelin helps in, yes, myelinated fibers are very fast in conduction and myelin helps in fast conduction. What are all the substances which can easily pass through the cell membrane? Cell membrane is basically a bilipid layer with proteins in it. This model was proposed by Singer and Nicholson. Since it is a bilipid layer, all the lipid soluble substances like oxygen and carbon dioxide gases, they are lipid soluble. They can easily penetrate the membrane and they can go into the cell. Whereas water soluble substances, the cell membrane is made up of lipids. So if any substance is water soluble, it can't penetrate the cell membrane. So they cannot cross the bilipid layer. For example, sodium and glucose. And that is why we have special type of transport mechanisms to carry sodium and glucose. For oxygen and carbon dioxide, we don't have any transport mechanism because they are lipid soluble. They can directly go into the cell. But substances like sodium and glucose, which are water soluble, has to be carried by transport mechanisms. Little more in detail about the cell membrane structure. We said that it is made up of proteins and lipids. What are these proteins? Integral proteins and peripheral proteins. Integral means inside the cell membrane. So this is present within the cell membrane. So if any protein is present within the cell membrane, it is going to connect the inside and outside of the cell. So when it is connecting the inside and outside of the cell, they act as receptors, channels, carrier proteins. So all these integral proteins become receptors, channels and carrier proteins connecting the inside and outside. Peripheral proteins. What are the peripheral proteins? They are mainly responsible for maintaining the structure, the framework of the cell, the shape of the cell, especially on RBCs. Spectrin, ankyrin and band 3 protein, they give the shape of the RBC. So if there is any defect of spectrin, ankyrin or band 3, the shape of the RBC changes and this is called spherocytosis or elliptocytosis. Hereditary spherocytosis, hereditary elliptocytosis. Dystrophin. Dystrophin is a muscle protein and any defect in dystrophin can result in muscle dystrophy. Dystrophin mutation results in muscle dystrophies. Duchenne's dystrophy, Becker's dystrophy. So that's about dystrophin. These are all the protein content. What about the lipids on the cell membrane? We have phospholipids, glycolipids and cholesterol. The phospholipids. Phospholipids could be present outside the cell membrane or inside the cell membrane. What are the phospholipids present outside the cell membrane? phosphatidylcholine and sphingomyelin. What is the other name for phosphatidylcholine? Yes, lecithin. What is the clinical importance of lecithin and sphingomyelin? Lecithin and sphingomyelin, they form components of surfactant. They help in reducing the surface tension, therefore they are components of surfactant. And sphingomyelinase. In biochemistry, there's a whole lot of diseases related to sphingomyelinase deficiency. Yes, Niemann-Pick's disease. Niemann-Pick's disease is due to sphingomyelinase deficiency. The phospholipids present inside the cell membrane, what are they? Phosphatidylserine, phosphatidylinositol and phosphatidylglycerol. Phosphatidylglycerol is called cardiolipin. What is phosphatidylserine? This is present on platelets and this helps in clot formation. So any defect in phosphatidylserine results in a clotting disorder called Scott syndrome. Scott syndrome. Phosphatidylserine helps in clotting. So defect in phosphatidylserine results in Scott syndrome. Phosphatidylinositol, this forms the precursor for second messengers like IP3 and DAG. IP3 is inositol triphosphate, DAG is diacylglycerol. So phosphatidylinositol is the precursor for synthesis of IP3 and DAG. Phosphatidylglycerol, which is called cardiolipin. In some diseases, there are anti-cardiolipin antibodies. Anti-cardiolipin antibodies. These are all called antiphospholipid syndrome. Autoimmune diseases like SLE, systemic lupus erythematosus, or multiple thrombus formation, recurrent abortions, you have to rule out this antibody, anti-cardiolipin antibodies. It's a marker for autoimmune diseases. Glycolipids like gangliosides and cerebrosides. In biochemistry, you have gangliosidosis and cerebrosidosis, disorders related to this. Cholesterol. Cholesterol mainly helps to maintain membrane fluidity. The membrane fluidity is maintained by cholesterol. So these are all the cell membrane proteins and lipids which are of clinical significance. So with that, next let's move on to the cytoskeleton elements. What are the components of the cell which form the cytoskeleton elements? We have microfilaments. Microfilaments, example, actin is a microfilament. We have microtubules. Microtubule helps in axonal transport. The kinesin, dynein, tubulin, all these are microtubule components. We have intermediate filaments. What are the intermediate filaments? Keratin, vimentin, desmin, laminin. These are the intermediate filaments. All these together, they form the cytoskeleton element of the cell, the framework of the cell. Over to membrane transport mechanisms, transport across the cell membrane. Broadly, there are two types of transport, active transport and passive transport. Let's discuss that in detail. Transport across cell membrane is a very important topic. Let's do this with the help of a mountain. Let's say there's a mountain there and you want to climb this mountain. How will you climb this mountain? You have to go from low to high. From low you have to climb to high. You are going against the gradient. So this is against the concentration gradient. Do you need energy for this? Yes, needs energy. You have to climb actively. This is called active type of transport. Against the concentration gradient, from low concentration to high concentration, and this needs energy. What is your energy? If you break your own ATP, which is your own primary source of energy, this is called primary active transport. All ATPases, when you break your ATP, ATPases are example for primary active transport. All ATPases like sodium, potassium ATPase, calcium ATPase, or the H plus K plus ATPase, the proton pump present in gastric cells. So whenever you break your primary source of energy, what is your primary energy? ATP. If you break your own ATP, all ATPases are primary active transport. Secondary active transport. Secondary means, let's say, already there's your friend who is climbing the mountain. Now you want to climb the mountain, but you don't want to waste your ATP, you don't want to use your primary energy, but you want to climb the mountain. So your friend is already climbing the mountain. Now you just climb on top of your friend and your friend is going to carrying you. So who's going to carry you? Your friend. Your friend is going to secondarily carry you. He is going, along with him he is carrying you. So secondarily, along with sodium, if any substance is transported, most of the time the friend is sodium only. So along with sodium, if any substance is transported secondarily, that is called secondary active transport. So if the substance, sodium and the substance go in same direction, this is called a symporter or a co-transporter. Example, SGLT, very important, SGLT, sodium glucose co-transporter. SGLT is sodium glucose co-transporter. NIS, sodium iodide symporter. Where is NIS present? Iodide transporter will be present in which gland? Yes, the thyroid gland for thyroid hormone synthesis. Iodine is the raw material. So sodium iodide symporter on your thyroid glands. NKCC, sodium potassium chloride transporter in your kidneys, in the nephron. So if sodium and the substance move in same direction, it's called a symporter or co-transporter. Antiport or counter-transporter. If sodium and the substance go in opposite directions. So all exchangers, sodium calcium exchanger, NCX, sodium hydrogen exchanger, NHX. So if sodium and the substance are going in opposite directions, this is called as antiporter or counter transporter. So that's how we understand active transport. So active transport is against the gradient, needs energy. If you break your primary ATP, that's called primary active transport. Secondarily, along with sodium, is called secondary active transport. Now over to passive type of transport. So now imagine you are already on top of the hill and you just want to come down. You are going to come along the gradient from high to low. Along the gradient, high to low. Do you need energy? This does not require energy. You can just lie down there like a sliding board. You can just come down. No need of energy. This is called passive type of transport. What are the different types of passive transport? Simple diffusion, facilitated diffusion, and osmosis, non-ionic diffusion. Simple diffusion is simply if you go across the membrane, nobody is carrying you, you just lie down, simply you just come down like that, that's called simple diffusion. Oxygen and carbon dioxide across the respiratory cell membrane, because there are no transporters for oxygen and carbon dioxide, simply they can go across the cells, that's called simple diffusion. Facilitated diffusion, if somebody is going to facilitate you. What is facilitation? Facilitating means helping. Yes, who is going to help you? Let's say there is a bus on top. The bus is going to carry you down. But the problem with the bus is, a bus can hold a maximum of 50 people. If you are the 51st member, there is no space for you. You can't come down because it has already reached its Tmax. It has already reached the transport maximum. Now you cannot come down. It will get saturated. You have to stop there. You can't come down. So transport maximum and saturation are followed by facilitated diffusion. Example, GLUT transporter, glucose transporter. SGLT is different from GLUT because SGLT is sodium along with glucose, and SGLT is an example for secondary active transport. But this is only GLUT, only glucose transporter. This is a carrier protein which will carry only glucose. UT, urea transporter. So GLUT and urea transporters are example for facilitated diffusion. The other type of transport for water, this is called osmosis. Water uses water channels called aquaporins. Aquaporins are water channels. So transport of solute, passive transport of solute or salts is called facilitated diffusion. whereas passive transport of solvent is called osmosis. Mostly solutes are transported by facilitated diffusion, and water is a solvent. Solvent is transported by osmosis. What about non-ionic diffusion? Non-ionic means not for ions. Then for what? For weak acids like salicylic acid and weak base like ammonia. Not for ions but for acids and bases. These are the different types of passive transport across the cell membrane. So let's discuss in detail about this sodium potassium ATPase pump, because the pump was a diagram question. I'll just show you how the pump looks like. So this is the cell membrane, the ECF, extracellular fluid, and ICF, intracellular fluid. This sodium potassium ATPase pump, it is present on the cell membrane. It has alpha and beta subunits. The sodium potassium pump has alpha subunit and beta subunit. On the alpha subunit, inside the cell, there are binding sites for 3 sodium. And outside the cell, on this alpha subunit, you have binding sites for 2 potassium. So what is the function of the sodium potassium ATPase pump? It will send out the 3 sodium and it will take in the 2 potassium. So the stoichiometry is 3:2. 3 sodium is to 2 potassium. So the function of sodium potassium ATPase pump is to send 3 sodium out and to take inside 2 potassium. 3:2. There is one hormone, insulin, and insulin increases the activity of sodium potassium pump. So the pump activity can be increased by sodium potassium ATPase pump. Activity is increased by insulin. There is another substance, digitalis, and digitalis is a substance which will decrease the activity of this pump. Digitalis decreases the activity of sodium potassium ATPase pump. So insulin increases the pump activity, whereas digitalis decreases the pump activity. So that was about the sodium potassium ATPase pump. Just a word about the different type of glucose transporters. We had already seen SGLT, 2 types, SGLT1 and SGLT2. SGLT is a type of secondary active transporter. SGLT1 on small intestine and renal tubules for absorption of glucose. So when you eat glucose rich food, how is that glucose absorbed from your intestine? By SGLT1. And on renal tubules for absorption of glucose. On the kidneys, to reabsorb glucose from urine, you have SGLT2 on the kidneys. GLUT transporter, on the other hand, GLUT transporters, they are all facilitated diffusion. Facilitated passive type of transporters. The different types of GLUT, GLUT1, GLUT2, 3, 4 and 5. GLUT1 mainly present on placenta, blood-brain barrier, brain, RBC, kidneys and colon. This helps in basal glucose uptake. GLUT2, this is the glucose sensor on the beta cells of your pancreas. So this can help in transport of glucose out of the intestine and renal cells, and it is also present in the liver. GLUT3, this also helps in basal glucose uptake, present on brain, placenta and the kidneys. GLUT4, very important, because it's a repeat question. GLUT4 is called as insulin dependent glucose transporter. Repeat question. Where is insulin dependent glucose transporter present? On skeletal muscle, cardiac muscle and adipose tissue. GLUT5, F for 5, F for fructose. So this helps in fructose transport, especially in your jejunum and the sperm. So these are the different types of glucose transporters. There's another special type of transport which is called vesicular transport. The vesicular transport, how vesicles are helping you in transport. These vesicles can move the substance out of the cell, or they can take the substance into the cell. So likely they are called as endocytosis and exocytosis. So in endocytosis, the vesicles are bringing the substance into the cell. This is endocytosis. If it is pushing the substance out of the cell, that's called exocytosis. So endocytosis and exocytosis, how vesicles are taking the substance into the cell, or they are pushing the substance out of the cell. That's called endo and exocytosis. First, let's do endocytosis. Endocytosis is of three types: phagocytosis, pinocytosis, and receptor mediated endocytosis. Phagocytosis is called cell eating because you are going to eat solid particles. Phagocytosis means cell eating, engulfing of dust, virus, bacteria, any foreign solid substance is engulfed. That's called eating. If the cell is going to engulf a liquid substance, that becomes drinking, cell drinking. So pinocytosis is endocytosis of liquid particles, that's called cell drinking. Receptor mediated endocytosis. In this, a receptor is going to help you. That's called receptor mediated endocytosis. So in receptor mediated endocytosis, there are 4 different proteins which will help you: clathrin, caveolin, megalin, and tubulin. Clathrin, caveolin, megalin, and tubulin. Megalin. Megalin helps in endocytosis of albumin, thyroid hormones, hemoglobin, etc. If there is any defect in megalin, all this endocytosis will be affected. Endocytosis of albumin, thyroid, hemoglobin, many parts of the body are affected, so it becomes a syndrome. This is called Donnai-Barrow syndrome. Donnai-Barrow syndrome. Defect in megalin. The other one is tubulin. Tubulin helps in endocytosis of vitamin B12. So any defect in tubulin, what will be the resulting disorder? Exactly, B12 deficiency, and B12 deficiency results in megaloblastic anemia. Megaloblastic anemia. So defect in megalin, Donnai-Barrow syndrome, defect in tubulin can result in megaloblastic anemia. That's about endocytosis. What about exocytosis? Exocytosis means how we are going to send the substance out of the cell. This is of 2 types: constitutive, non-constitutive. Constitutive means the substance is not processed inside the cell. Before sending out, it is not processed, just like that it is sent out. But if the substance is processed inside the cell, for example, it could be a prohormone, it is processed into the hormone. It could be an inactive enzyme, it is converted into an active enzyme. So if any processing like this happens and then it is sent out, this is called non-constitutive. If both endocytosis and exocytosis happens at the same time, then it becomes transcytosis. Transcytosis. The vesicular transport of macromolecules from one side of the cell to the other. So one example for transcytosis. So if this is the intestinal cells of the baby, when this baby drinks breast milk from the mother mother's breast milk contains antibodies. So the antibodies in the breast milk, when the baby drinks this milk, so this antibody is taken in on one side, which means it is endocytosed on one side. It enters into the intestinal cells of the baby, and on the other side it is exocytosed. And finally, this antibody has reached the baby's blood. So that was the question. How do maternal antibodies present in the breast milk cross the intestinal cells of the baby, and how does it reaches the baby's blood? So it is endocytosed on one side, exocytosed on the other side. So that becomes an example for transcytosis. Both endocytosis and exocytosis happening together. So that becomes transcytosis. And this type of vesicular transport, it is not dependent on any type of concentration gradient, because active transport is against the gradient and passive transport is along the gradient. But this type of transport is not related to concentration gradient at all, just by vesicles, how vesicles are helping you in the transport. So that's called vesicular type of transport. So with that we complete the topic transport across the cell membrane. The other topic in cell physiology, cell junctions. Quickly let's do cell junctions. So cell junctions, the different type of cell junctions. First of all, you should know what is a cell junction. Two cells are connected to each other by cell junctions. For example, when the cells are all created, when the first cell was created, so this is the first cell, and this multiplies as the second cell and the third cell. So the first cell, how is it attached to the second cell? By a cell junction. So this is one type of cell junction. This cell junction connects one cell with that of the other cell. How is the second cell attached to the third cell? By this cell junction. So we have the first group of cell junction which connects one cell with that of the other cell. Now, how all these cells are connected to the body surface at the basolateral membrane. So that is another type of cell junction. So we have two type of cell junctions. How one cell is connected to the other cell, and how all these cells are connected at the basolateral membrane. These are the two different type of cell junctions. Let's discuss cell junctions, the important points related to cell junctions. So you can see two cells here, first cell and the second cell. Any cell will have two sides. The lumen facing side is always called the apical membrane or the luminal membrane. So for this cell, I have marked the apical or the luminal membrane. On the other side, it's the basolateral membrane. So this cell has two sides, apical membrane or luminal membrane and the basolateral membrane. Now what are the transporters which are, or what are the junctions which are present on the cell? The first type of cell junction, which is very close to that of the apical membrane, but it is not on the apical membrane, it is on the apicolateral membrane, just lateral to the apical membrane. On this apicolateral surface, there is a junction which is very, very tight. So I call it as, yes, tight junction. So this is a tight junction. Tight junctions, since they are very tight, they help in forming blood-brain barrier, water seals, tight water seal. Where do you need tight water seals? To prevent the water leak. Yes, in your intestines you need tight water leak. In your renal tubules, nephron, you need tight water seals to prevent water leak. So in all areas wherever there's a need for preventing the leakage of water, you will have tight junctions. That forms the tight water seals. And tight junctions, they are made up of proteins called claudins and occludins. Claudins and occludins. That is why the other name for tight junction is zona occludin. Zona occludins. And these tight junctions, they are not present in the cardiac muscle, because cardiac muscle has to function always the heart has to beat. As long as you live, the heart has to beat. So if there's any tight junction on the heart, that is going to affect the continuous beating of the heart. So these tight junctions, they are absent on cardiac muscles. Yes, that's about the tight junctions. If you have a tight junction, you should have a loose junction also. We can't call it as a loose junction. So now let me call this as a gap junction. Where there is a gap between the cells, this is called a gap junction. And gap junctions, they are otherwise called nexus. They are electrical coupling between the cell, electrical connections between the cell. And where do you need more electrical connections? Wherever there is a syncytium. Syncytium means the whole organ will contract and relax together. That's called syncytium. The whole organ is contracting and relaxing together. What are the organs which will contract and relax together like this? Yes, the cardiac muscles, the heart, cardiac muscles. And your intestines will contract, relax together. Your blood vessels will do this. Bladder, uterus, what type of muscle is all this? Yes, smooth muscles. So cardiac muscles and smooth muscles which move as a syncytium have plenty of gap junctions. So we already saw tight junctions are absent in cardiac muscle, but cardiac muscle is rich in gap junction, the electrical connections between the cell. Gap junctions are very fast connections. So that's about the gap junctions. The other type of cell junction where two cells, just a word about the gap junction. This gap junction is made up of connexons. Gap junctions are made up of connexons, and each connexon is made up of 6 connexin. Gap junctions are made up of connexons, and each connexon will be made up of connexins. And these connexins are very important because connexins, mutations of connexins are related to diseases. For example, connexin 32 mutation. Connexin 32 mutation is called Charcot-Marie-Tooth disease. Connexin 32 mutation is called as Charcot-Marie-Tooth disease. So that's about connexons and connexins. Next, let's move on to the other type of cell junction where two cells are connected by actin. So when two cells are connected by actin, this is called as zona adherens. And zona adherens is made up of cadherins. And any defect of this cadherin can result in hypotrichosis. Hypotrichosis with juvenile macular dystrophy. Hypotrichosis with juvenile macular dystrophy. Mutations or any defects in cadherins can result in this disease. That's about the zona adherens. When two cells are connected by an intermediate filament, like this. When two cells are connected by an intermediate filament. What are the intermediate filaments? Intermediate filaments are keratin, vimentin, lamin, desmin. All these are intermediate filaments. When two cells are connected by intermediate filaments, this is called as a desmosome. A desmosome. Desmosomes are made up of desmocolin and desmoglin. Desmocolin and desmoglin. if there is any defect of desmocolin or desmoglein. For example, autoantibodies against desmocolin or desmoglein. What is that resulting disease called as? So this is related to intermediate filament. Keratin is an intermediate filament. Where is keratin present? Skin. Yes, so it results in skin diseases like pemphigus. Since keratin is related to the skin, defects or autoantibodies against desmocolin and desmoglein can result in pemphigus vulgaris. Pemphigus vulgaris. So these are all the different type of cell junctions which connect one cell with that of the other cell. Now let's see two type of cell junctions which are going to connect all these cells with the body surface at the basolateral membrane. What are they? Focal adhesion molecules and hemidesmosome. Focal adhesion molecules and hemidesmosomes. Focal adhesion molecules are made up of integrin and hemidesmosomes are made up of, focal adhesion molecules are made up of actin and hemidesmosomes are made up of integrin. That's about the two type of cell junctions which connect all the cells with the basolateral membrane. I'll mark the basolateral membrane. This is the basolateral membrane. So that was a repeat question. Which is that cell junction which is present at the basolateral membrane? Focal adhesion molecules and hemidesmosomes. Let's just try to answer this question. A patient presented with cirrhosis. On biopsy, liver shows multiple eosinophilic bodies which are cytokeratin positive. So what is this most likely composed of? Keratin is an intermediate filament. Yes, just now we saw. Keratin is an intermediate filament. So since the tumor has cytokeratin positive, this is most likely to be composed of intermediate filaments. What is Gibbs-Donon effect? What is Gibbs-Donon effect? Gibbs-Donon effect is when there are two compartments separated by a semi-permeable membrane. For example, let's say two compartments. Compartment 1, which is inside the cell, ICF, and compartment 2 outside the cell. When there are two compartments separated by a semi-permeable membrane like ICF and ECF, there are two compartments here, and the presence of impermeable substance in one compartment. For example, proteins are impermeable. Proteins are negatively charged and proteins cannot cross the membrane also. They are impermeable. So if you have an impermeable substance like protein in one compartment, protein cannot cross the membrane. Since protein cannot cross the membrane, it is accumulating negativity inside the cell. This negativity will keep more positive ion sodium inside the cell. It will attract more positive ions, keeping more positive ions inside the cell. And this sodium which is accumulating inside the cell, now it will start pulling chloride. Wherever sodium goes, chloride will follow. Sodium chloride is a salt. Wherever salt goes, it will pull water. So this begins to pull water inside the cell. If there is so much of water inside the cell, slowly the cell begins to swell. Because of accumulation of this water, the cell begins to swell. At one point, the cell will burst. So this swelling and bursting of the cell, this is called Gibbs-Donon effect. So because of Gibbs-Donon effect, excuse me, the cells are swelling and bursting. But our cells are not swelling and bursting like this. Why your cells are not bursting like this? Because we have the rescuer. Who will protect us? So we have sodium, potassium, ATPase. All cells on the membrane, they have sodium potassium ATPase, and the function of sodium potassium ATPase is to throw sodium out of the cell. Whenever sodium moves, it will pull chloride out of the cell. Sodium chloride pulls water out of the cell. When water goes out of the cell does not swell. So Gibbs-Dunon effect is swelling of the cell and bursting of the cell, but it is not happening because it is prevented by sodium potassium ATPase. So let me read this for you. When there are two compartments separated by a semi-permeable membrane, the presence of an impermeable ion affects, impermeable ion is the protein. Just because protein didn't move, all this happened. So the presence of an impermeable ion like protein in one compartment affects the movement of all other permeable ions. Just because protein did move, all others had to move. So protein only made others to move. This affected the movement of all other permeable ions, resulting in swelling and bursting. This is called Gibbs-Dunon effect. But it's not actually happening inside your body because it is prevented by sodium potassium ATPase. So who is preventing Gibbs-Dunon effect? Sodium potassium ATPase. Just a word about the different type of ion channels, because in every part of physiology, in systemic physiology, neuro, cardio, we will be dealing with all these terms. So you should know what are these terms related to. Gated channels. So we have voltage gated channels. Voltage gated channel means they will close and open in response to a change in voltage. What are the examples for voltage gated channels? Voltage gated sodium channel, VG for voltage gated, N for sodium, C for channel. And voltage gated potassium channel, voltage gated sodium channel, voltage gated potassium channels. Ligand gated channels. What are the ligand? Ligand means a chemical substance. A chemical substance will control the channel. Whenever chemical substance binds, the channel will open or close. For example, nicotinic acetylcholine channel. Whenever acetylcholine binds, this channel will open and close. GABA channels. So they are all gated by chemicals. GABA is aminobutyric acid. Yes, gamma aminobutyric acid. Mechanically gated channels. Mechanically means there should be a mechanical stimulus. For example, stretch activated channel. Stretch is a mechanical stimulus. Mechanosensitive channels in baroreceptors. Baro means pressure activated channels. Hair cells in the ear. Inside the ear you have hair cells. When they move, it's a mechanical stimulus. Touch sensation because of piezo channels. Piezo is a recently discovered channel which is responsible for touch. Touch is a mechanical stimulus. So when any mechanical stimulus is opening the channel, this is called mechanically gated channels. Leaky channels. They are always open. They'll always keep leaking. For example, potassium leak channels, which is the major contributor to resting membrane potential. Very important point. We will discuss this in nerve physiology also. Leaky channels, potassium leak channels are the major contributor to RMP. Leaky means they are always open. They are not gated by any voltage or any chemical substance. Always leaking. They are always open. Yes, we have just completed the cell physiology. The first part of the general physiology, cell physiology is done. Before we move on to the other parts of the general physiology, so let's have a small break and then we'll continue. This may be a 5-minute break and then we'll move on to the remaining part of general physiology. Thank you.